You're listening to Cross Country Checkup on CBC Radio 1 and on Sirius Satellite Radio Channel 137. Joining me now is someone who works on the front lines of the fight against swine flu. Vicki McKenna is a registered nurse and is the first vice president of the Ontario Nurses Association. She's on the phone from Belmont, Ontario, which is just outside of London. So, Vicki, how have nurses been dealing with swine flu so far?
Hi, Andrew. Good afternoon.
Hi.
Well, our nurses and our members right across the province of Ontario have been working hard, as you know, in the first wave of H1N1, and also have been working hard to inform themselves and work as closely as they can with willing employers in respect to reviews of pandemic planning and in ensuring and requesting that nurses and other frontline health workers have their fit testing for the proper masks that are required, and themselves are just informed about what's happening, what the latest research is saying, and how they can best protect their patients and, of course, the public and also each other as they're caring for these people in hospitals and long-term care facilities, public health, and right across Ontario.
And are you ready? Are nurses ready for the coming, what's expected to be a resurgence of H1N1, what's expected to be a worse situation than what we faced in the spring?
Well, what I can say is that our leaders and members are seeking information and are requesting and working with employers in respect to being ready. They are informing themselves, and we as an organization, our union, has provided information hot off the press as quickly as we can via the web and our regular mail-out communications to our leaders and our publications to tell them what the latest news is. Where we're concerned is that we know that some of our employment sites, some of the institutions in the province of Ontario are not ready. Their pandemic plans are, in some cases, have not even been completed, and they're also, we know, resistant and lagging behind in fit testing their staff for proper respiratory and protective gear.
Why?
Well, this would be a bit of a mystery. Certainly, you know what, after what we experienced in Ontario during the SARS epidemic, and many people will well remember that there were a number of recommendations that came from Justice Archie, and we also know at that time that he said, this is not the time to be the time to be nickel and diming. This is not the time to be second guessing. What he said, what Justice Campbell said very clearly was this. He said, if the science is not clear, we err on the side of caution. And there is a lot of research out there. There is a lot of work that's been done in respect to influenza and in respect to H1N1. And that research is clear, is that we need to have proper respiratory protection for all first responders, as the paramedic earlier spoke about, and, of course, frontline healthcare workers that are caring for people who are ill and those that are potentially ill with influenza. The doctors there is some conflicting opinions, but the reality is that until the science is clear, we err on the side of caution, and the side of caution says we need proper respiratory protection. That's the N95 mask. That's proper fit testing. That's easy at hand protective gear, that there be a stockpile. We are recommending to employers and our leaders at least 4 weeks supply at hand, and that we are informing and doing the best job we can to let our folks know what is happening, what the research says. But what we're finding is that we have hospitals, we have some long-term care facilities, and some of our public health units that are slow. They're not moving too quickly forward, and we believe this is not the time to be lagging behind. This is the time to step up to the plate and say we're going to do the right thing to protect the public, and most certainly the people, of course, that are caring for those people who are ill. If our healthcare workers fall ill, we're in trouble. And we need to make sure that we have all those protections in place.
Well, let me ask you, I'm sure you're hearing from your members. Are your members saying, look, if we don't get enough of these special respiratory masks that are fitted, are they saying we're not going to work?
Well, what our leaders and what our members are saying is number one, that they are healthcare providers. They're nurses and other allied health professionals that care for people in the province of Ontario. They want to be at work. And what they expect from our government and from their employers is the proper protective equipment. And they expect it to be there for them at hand when it's required. And that's what they're asking for. They want to be there. They're not saying to us right now that they're not going to work. That's absolutely not what they're saying. They're saying they're going to be there. They want to be at work, but they want to know that when they walk in there to do their shift and to be there to care for Ontarians, that they have the equipment that they need. And that's not a lot to ask for.
Are you surprised and disappointed, given the experience with SARS here in Ontario, given the experience with SARS, given the fact that we saw H1N1 in the spring? Are you disappointed? Are you surprised that there are these institutions, a number of institutions that aren't ready?
I'm disappointed that they're not ready. I must say that I'm not surprised. We have been...
Why not? Why aren't you surprised?
Well, there always seems to be, and as you well know, in Ontario and right across the country, I'm sure there's similar conversations going on. There's decisions being made based on dollars. And in respect to health care and protection of the public, I don't think that is the number one filter that should be used in deciding whether they would have enough masks on hand or not. I think that protective gear, the proper equipment, safe equipment for patients and for staff should be there for the people that are caring for patients and to protect the public. And we believe that sometimes decisions are being made based on dollars rather than what's the right thing to do, and that this is healthcare. This is about the safety of the public and the care that Ontarians that is basic to Ontarians and Ontarians deserve. And this should not be the filter. I believe that that's probably one of the reasons that some institutions have not stockpiled, are not ready in their mask supplies. The one thing, though, that I'd like to say is that we've been talking about this certainly for some weeks and months now since the initial outbreak, and been saying to our leaders and members, be approaching your employers, talking to them about it. We're certainly talking to the ministry about it and speaking to other colleagues right across the country in respect to what they're doing in awareness and talking about it openly. No one here wants a disaster. No one wants there to be a catastrophic event. And we're going to push hard, and we're going to be very vocal about preparation and about employers stepping up to the plate and doing the right thing.
And what kind of response are you getting? You talked about you're talking to the ministry,
yes.
The health ministry. What kind of response are you getting from them?
Well, we're talking to the health ministry as well as the Ministry of Labor, and where we know that we have or believe that there's deficient preparation, we're having our leaders call the Ministry of Labor to come in and do an inspection, and that's something that's available to workers in any work environment if there isn't proper equipment and preparation and care taken. So that's on the Ministry of Labor side. On the Ministry of Health side, we're talking to the Ministry of Labor or to the Ministry of Health, and telling them, and talking with them about what the latest research is, what the preparedness level should be at what stage, and what the minimum requirements are. One of the things we learned very clearly in SARS is that communication is key. And if there's conflicting or contradictory communication or inconsistent communications, that's where things fall off. And so we want to be sure that we're operating on the best knowledge and the best information, that we're listening and talking with our Ministry of Health and our medical officers of health and our employers, and we're saying the same things, and that communication is going right down to the first responders, to our frontline healthcare workers who aren't on the web, they're not on the telephone, they're working. They're caring for people every day, and they need that communication brought to them. They're not sitting in front of a computer looking at a screen all the time. They're out there caring for people. So they rely on their supervisors, leaders, head nurses, hospital CEOs to say, this is what you need to do, and I need to know as a union leader, and my nurses need to know, and other allied health professionals, that the information that they're receiving is correct and that they're doing the right thing for the patients and for themselves and families.
Vicki, really appreciate you taking the time to chat with us today. Appreciate it. Thanks very much.
Thanks very much. Have a great afternoon.
You too. Vicki McKenna is a registered nurse and is the first vice president of the Ontario Nurses Association. She was on the line from Belmont, Ontario.
For more on all of our CBC podcasts, head to cbc.ca/podcasting.